Welcome everyone to this masterclass on fetal echogenic cardiac focus. This session is going to be highly crisp and conceptual. We often get a lot of patients, and the parents are really worried because the ultrasound report has this particular finding, and rightfully so. So let's decode this particular clinical entity, and we'll be starting from the scratch, and we'll be going to an advanced level and try to really understand about this particular topic. And this session is designed for both healthcare professionals as well as for the patients who are really curious to know about this particular topic. Okay, let's first discuss about the definition of fetal echogenic intracardiac focus. We want to know what is it exactly. Now, I want you to look at the screen now. Now, this fetal echogenic intracardiac focus, they're nothing but microcalcifications of the papillary muscles of the heart. Now, papillary muscles, they're tiny muscles, tiny conical muscles arising from the wall of the lower chambers of the heart. And with these papillary muscles, we have got fibrous string-like structures which supports the valvular leaflets. Okay, so I'm just going to show you what exactly is the papillary muscle. So can you see this picture? So look at this picture now. I want everyone to look at this picture now. So this is the papillary muscles right over here. Okay, and you can see this, some string-like structures arising from the papillary muscles, and they are known as chordae tendineae, and they are supporting, these are the valvular leaflets. Okay, so and they are present on the interior of the lower chamber of the heart, or the ventricles. We can see in another picture. So these are the papillary muscles over here, and this is here and here. So this is the left ventricle, this is the right ventricle, and we have got the chordae tendineae attached to the papillary muscles, and they're supporting the valvular leaflets. All right, so these are very, very important. Now, so when this papillary muscles gets calcified, they looks bright or white on ultrasound. And if you can see this picture, so you can see a very bright spot, which is nothing but the calcified papillary muscles. And just let's orient yourself with this ultrasound. Now, this is your right atrium, this is your left atrium, this is your right ventricle, and this is your left ventricle. So you can see echogenic foci within the left ventricle, and the most common site for this particular finding is the left ventricle. Sometimes it may be present on the right ventricle, or sometimes it may be biventricular. That means it can be present in both right and left ventricles. Now, usually it is found on anomaly scan, which is done somewhere between 18 to 20 weeks period of gestation. Now, we'll be going through some pictures right now. So yeah, so this is another picture for echogenic cardiac focus. Can you see this? This is the echogenic cardiac focus right over here. So yeah, this is nothing but the calcified papillary muscles, as we already discussed. Now we'll again orient ourselves with this picture. This is your right atrium, this is your left atrium, this is your left ventricle, and this is your right ventricle. Am I clear with this? Now, yes, in this particular ultrasound finding, we can see that the calcified papillary muscles present in both the ventricles. So these are basically known as biventricular echogenic cardiac focus. All right. So, and it is one of the soft markers. It is one of the soft markers for Down syndrome. Right. In Down syndrome, we have got some chromosomal anomaly, which is chromosomal aneuploidy, and which is popularly known as trisomy 21. So instead of 2 copies, we have got 3 copies of chromosome 21. Now, so this is a picture of the fetal heart. We can see here the papillary muscles right over here. You can see the papillary muscles right over here, coordinated attached to this, and they're supporting the valvular leaflets. Here also, you have the papillary muscle. Here also, you have the papillary muscles coordinating, really arising from it, supporting the valvular leaflets. All right. I've already gone through these pictures. Now let's talk about the incidence of the echogenic cardiac focus. It is not very high. It is just 3 to 5%, but it is more common among the Asian women. All right, so it is more common in the Asian population compared to the rest of the world, and it is like 3 to 5% worldwide. Now, if a woman is having this finding in the ultrasound and she's really concerned with that, we need to make sure that she has already undergone the screening for Down syndrome. If not, then we have to do certain blood tests as well as ultrasound to rule out whether there is any soft markers for Down syndrome or not. Now, Down screening or the screening for Down syndrome has been a routine right now, and we do it for each and every single pregnant woman. In the first trimester, somewhere between 11 to 14 weeks, we do combined test. We do blood test along with ultrasound. We call it NT test, popularly known as nuchal translucency test. And if at all the patient is in that second trimester, somewhere between 16 to 18 weeks, we can do like triple test, which is combined of beta HCG, alpha fetoprotein, and unconjugated estriol. We can do quadruple test along with this 3 tests. If we add inhibin A, it becomes quadruple. And in modern era, we are preferring something known as a pentascreen along with quadruple test. If we add hyperglycosylated HCG, it becomes a pentascreen. Yes. So if at all the woman is having the finding of echogenic cardiac focus, I have to make sure that the woman has undergone Down screening. If there is low risk, then you just need to give reassurance to the parents that nothing is going to happen. It is going to resolve within a span of like few weeks. Usually it takes 4 to 6 weeks to get resolved. And to be on the safer side, we do prescribe a fetal echo, which has to be done if at all there is some concern with the structural anomalies of the heart, or to rule out the structural anomalies of the heart. Yeah, so there's basically soft markers for the Down syndrome. We have got increased nuchal skin fold thickness. We have got echogenic intracardiac focus. We have got echogenic bowel. Now, echogenic bowel means the bowel appears more white. Okay, like it's appear as white as the bones, or sometimes more echogenic than the bones. Then we have got the short femur, short humerus. We have got the mild ventriculomegaly. We have got the pilectasis, which is a dilated renal pelvis. We have got the absent or hyperplastic nasal bone. We have got single umbilical artery. We have got the clinodactyly, which means the short middle phalanx of the 5th digit of the hand. We have got sandal cap. Okay, these are the soft markers, and these are the pictures. You can see this in the first picture. We can see this is the choroid plexus cyst over here. Then we have got something known as the increased nuchal skin fold thickness. We have got the echogenic cardiac focus over here. Can you see this echogenic cardiac focus over here? Then we have got This is the pilectasis. We have a dilated renal pelvis. This is normal over here, and this is the dilated renal pelvis. So if you orient yourself, this is going to be the left kidney, this is going to be the right kidney. This right renal pelvis is normal, the left renal pelvis is dilated. All right, and this is echogenic bowel. Now this is the echogenic bowel, which looks whitish or bright. Okay, now we have got something. Now if there is like if there is high risk for Down syndrome, right, in the Down screening, if the risk is very high, less than like 1 in 250, then 1 is to 250, 1 is to 250, then we go for NIPT, which is basically non-invasive prenatal testing. It is a non-invasive test. We take the mother's blood and we assess the genetic configurations, and we assess the right chromosomal configurations, and we assess the chromosomal configuration to rule out Down syndrome, and we assess the chromosomal configuration to rule out the Down syndrome. It's a non-invasive test, and we so if so if there is positive screening test for Down syndrome, the next step is this. Initially, we used to go for amniocentesis straight away, but right now we don't go for amniocentesis straight away because it is invasive. So what we go for is NIPT, non-invasive prenatal testing. So here we analyze the DNA. We call it cell-free fetal DNA, and it's just a simple blood test. And if the NIPT is negative, it is very, very accurate test. The accuracy is more than 99% for Down syndrome. And if the test result comes out to be negative, then we don't need to go for a amniocentesis followed by karyotyping. Okay, and then we don't, if the NIPT report turns out to be negative, then we don't need to go for invasive test like amniocentesis, because after all, it's an invasive test. NIPT is a non-invasive test. It's just a simple blood test, but it's very, very accurate. The accuracy is more than 99% for Down syndrome. Okay, but if the NIPT report turns out to be positive, then to diagnose if the NIPT report turns out to be positive, then to diagnose the disease, we might need to go for amniocentesis. After all, NIPT is a screening test, but it's a very, very accurate screening test. Right? Similarly, just to touch on the topic, echogenic bowel. Okay, it's also another soft marker for Down syndrome, where the bowel loops look very white, and it is like as white as the surrounding bones, or sometimes even more. So in this picture, this is the can you see this? This is the echogenic bowel loops here. This is the gastric shadow. Okay, and this is the fetal spine. Okay, so can you see the bowel looks as white as the fetal spine. All right, now, so in short, if we get this finding of fetal echogenic cardiac focus and the screen is negative, the screening for Down syndrome is negative, okay, then just go for a fetal echo, just to be on the safer side, to rule out structural fetal cardiac anomalies. That's it. If the fetal echo turns out to be absolutely normal, just give the parents reassurance, counsel them properly that nothing to be worried about. It is going to resolve of its own within like 4 to 6 weeks or 8 weeks max. It never, almost never persists beyond 8 weeks. Okay, if If the down screening is positive, go for NIPT. If the NIPT comes out to be positive, go for amniocentesis just to diagnose the chromosomal aneuploidy, which is trisomy 21. If the NIPT report turns out to be negative, it being highly accurate, we don't need to go for amniocentesis, which is an invasive procedure. And but in most of the cases, more than 90% of cases, it is an isolated finding. It is not associated with trisomy 21, right? But yeah, in case like 10% of cases, it may be associated with some sort of like chromosomal aneuploidy like trisomy 21. So in short, you should be very thorough with your antenatal checkup. You should not be too much anxious if if your anomaly scan report shows this particular thing, and you should consult your obstetrician. And thank you so much. Have a great day. Bye bye.